All right. Well, good afternoon, everyone. My name is Craig Haney, and I am the Director of Marketing here at Energent. I wanted to thank you for taking the time to learn a little bit about benchmarking principles here in the public sector, and more specifically, we'll be focusing on the healthcare side, although these principles can be taken across multiple sectors, including institutional healthcare and commercial. Benchmarking is a tool that has been used in many industries to understand how buildings, processes, and people compare to each other. The two most important aspects of benchmarking is choosing the proper metrics to compare and ensuring you have access to relevant data to compare those apples to apples. Without these two components, benchmarking programs are not able to provide the maximum benefit for participating organizations. We will use today's webinar to explain how you ensure you are able to choose the right metrics and have the data available to compare these metrics. We will also look to provide some of the best practices from benchmarking programs. These best practices will look at ways of collecting, comparing, and utilizing the data to maximum benefits for buildings. This is where benchmarking programs can really focus on providing value, beyond just where a particular hospital lies along some sort of curve. If you have any questions during the presentation, please use the Questions tab to the right of your screen and type your questions. We will definitely save some time at the end of the presentation to answer as many of the questions as possible. The presentations take about 30 minutes, and we'll leave about 15 minutes for those questions that people may have asked throughout the webinar. The webinar will also be recorded and posted on our website, so if you want to refer to this webinar at a later time, you are certainly able to. As well, you're able to forward this link to any colleagues that may be interested in the topic but were unable to attend today. So, let's begin. So today's webinar will focus on benchmarking, how to use it, how it has been used by the field by reviewing local case studies, and how you can transfer this knowledge to your staff through best practices. As always, we'll leave lots of time for questions at the end of the presentation. So let's start by understanding at the beginning what benchmarking is. Benchmarking is defined as an objective way to compare buildings using key performance metrics. There are two important components to this definition. The first is choosing the proper and most appropriate performance metrics that are relevant for all buildings that are being compared to in the benchmarking graph. The second component that is vital for a relevant benchmarking tool is to ensure the data that is being measured and collected is in a consistent manner. If these two components are consistently being monitored for all participating buildings, then the data collected and the results presented from the benchmarking tool can be very powerful and actionable. There are two fundamental types of benchmarking. There are longitudinal and cross-sectional. Longitudinal benchmarks compare the same building over time. The results can be used within an organization to compare energy performance throughout the year, identifying different operation levels based on seasonal changes. In cross-sectional benchmarking, buildings are compared to each other, other similar buildings. The results can be used to assess performance relative to peers in the same sector and across sectors, to track performance against sector performance levels, to identify new best practices for improving building performance, to increase understanding of how to evaluate energy performance, and to identify high-performing buildings. These comparisons are made possible because all of the data that is being used to make these comparisons is normalized for weather, square footage, type of operations, and for hospitals, possibly the level of care provided. These factors are all included in the development of the energy model. Any type of building can benefit from benchmarking, and here are the 6 most common values that are attributed directly to the benchmarking practice. Number 1, it gives energy managers the important information they need to determine what energy drivers are important, measurable, and manageable, and conversely, which ones they don't have much control over. Number 2, using those key metrics, it helps establish baseline energy consumption and appropriate energy conservation goals. Some of those goals may be focused on capital upgrade projects. A proper benchmarking tool can help prioritize those upgrades to have the biggest effect on energy consumption. Number 4, real-time information facilitates continuous improvement programs. The new Energy Management Standard, ISO 50001, which we've done a few webinars on, sees continuous improvement programs as the cornerstone of any and every effective energy management program. 5, by comparing the same building's energy use over time and mapping specific operational procedures to the same timeline, it can help identify periods of best practice and attempts can be made to replicate these operational procedures. Lessons can also be learned from other comparative buildings that are having success in managing energy. And finally, number 6, for hospitals or jurisdictions that have multiple facilities to manage, benchmarking enables the opportunity to have competitions between buildings and reward good performance since all of the data has been normalized, allowing for apples-to-apples comparisons. Considering all of these aspects of benchmarking, the tool you use must be the right one for you. So let's look at 3 of the options. There are many benchmarking tools that have been established to support hospital or public sector benchmarking initiatives. The 3 we'll focus on today is the Environmental Protection Agency's, or EPA, Energy Star tool, the Greening Healthcare Initiative started by the Toronto and Regional Conservation Authority, and Energent's newest application, our hospital benchmarking tool. So let's dive into each one of these tools to see how to take advantage of them. EPA's Energy Star benchmarking tool, also called Portfolio Manager, was developed in 2000. Since then, it has been building a database of over 130,000 buildings across North America. These buildings have been included in Portfolio Manager to allow participating sites to be benchmarked against comparable sites in the database. It's a great example of cross-sectional benchmarking. The advantage of Energy Star are the considerable size and scope of the database. Portfolio Manager has been around for 12 years, and it has compiled necessary energy information for thousands of buildings since that time. Benchmarking tools are most statistically significant when they have this much data to compare to. Energy Star also has brand recognition across multiple sectors, making internal buy-in easier for staff and management, as the logo and concept is familiar. Benchmarking can be done within sectors, such as hospitals, but individual data can also be compared to across other industries which may be related. Energy Star provides 15 different building types which have been indexed within the Portfolio Manager. However, there are a few limitations with the tool set. It can be very time-consuming to implement, as all of the historical data must be manually implemented into the online platform. For sites that have multiple meters and that want to monitor multiple commodities, this can be a very daunting task. In the same scenario, to make a benchmarking tool relevant, this information must be maintained on a monthly basis by someone internal. Finally, the resolution of the data is only monthly, and since it's only being inputted in that interval. There are many scenarios in which savings opportunities may not show up on monthly data, and significant savings opportunities are missed, unless the Energy Manager is able to devote the appropriate time and expertise to reviewing and understanding the operations of the hospital at the necessary level of granularity. Energy Star is a very popular tool for commercial buildings and hospitals to use to understand their relative energy performance. Let's look at a couple of other tools that provide a little different perspective on benchmarking. The Toronto Region Conservation Authority started Greening Healthcare in 2003 with the idea that hospitals could work together to lower energy costs. There are currently 25 hospitals being monitored across Canada, with 23 of them in Ontario. With 25 of these organizations, there are 59 buildings that are currently being monitored. These sites are being monitored through self-reporting of energy use for both heating and cooling, and then the results are presented as cumulative savings on a benchmarking chart. The Greening Healthcare Initiative has been successful in signing up participants from Ontario, as currently there are 23 hospitals participating in the program. There are also 2 organizations from other provinces included, providing an interesting opportunity to compare hospital consumptions in different jurisdictions. The tool provides very simple and concise benchmarking using electricity and thermal equivalents as plots, and plots these numbers on a graph, comparing hospitals based on square footage. This presents a very simple and easy way of quickly assessing a hospital's current ranking. To support these hospitals, Greening Healthcare runs webinars and workshops for its members and the general community to encourage best practices for energy conservation programs across the hospitals. There are some limitations with Greening Healthcare. There has not been a consistent evidence of savings for the members that are using the tool. Ultimately, these tools are designed to enable hospitals to lower their energy costs, but there hasn't been evidence that this simple, high-level benchmarking achieves this goal. It is often limited by the lack of information available to the energy manager or facility operator, as these tools require more data to enable good decisions to lower their energy costs. Finally, the Greening Healthcare tool requires facility operators to input all of the information necessary for the tool to benchmark the data. These self-reporting systems are challenging as many users are unable to input the data each month and the data becomes inconsistent across all participating hospitals. These self-reporting tools are often less expensive but provide little data at the level that produces energy conservation behaviors. So the final tool we will review today is Energent's hospital benchmarking tool. We feel it's time to upgrade the current benchmarking tool to a level that is necessary to enable energy managers to take advantage of this information and reduce energy consumption. An ice cream cone is great, especially on a day like today. But what if we could upgrade to something even better? What if we were able to take the vanilla approach to benchmarking and add a few toppings to improve the appeal of the tool? Using real-time energy data, accurate modeling, and a national hospital database, Energent has created the tool that will give energy managers the knowledge they need to make informed decisions about their facility and ultimately come up with an action plan to improve their energy consumption. Energent's tool utilizes their national hospital database to compare information based on weather, regular hospital operations, and weekend and holiday factors. This information collectively allows energy managers to compare their hospital to the national database based on operations, weekends, holidays, and weather, but also understand the cost attributed to each level of benchmarking. Energy managers will understand the importance of separating weather from the regular operations of the hospital. This improves their ability to understand how to address energy conservation initiatives from the facility point of view. Finally, this data can be broken down into specific, measurable drivers, giving energy managers more access to the data, meaning they can act on specifics quickly and accurately. The two components of Energent's benchmarking tool are operations, which are represented by the columns above the horizontal x-axis, and weather-related energy consumption, which is represented by the columns below the horizontal x-axis. If the two are combined, then you would get the total consumption of the hospital per square foot. We will take a closer look at each one of these components more closely. This is the graph that's focused on only the operations side of energy consumption. The red line represents the 25th percentile, the blue line represents the 50th percentile, and the green line represents the 70th percentile. The graph is ranked from the worst performers on the left to the best performers on the right. The range of consumption is approximately 28 kilowatt hours per square foot for the worst performers and about 14 kilowatt hours per square foot for the best performers. This means that the best performing hospital operates their facility using approximately 50% of the energy per square foot than the worst performing hospitals do. To influence this part of the graph, staff could lower light levels, increase temperature, and turn computers off at night. The second aspect is the effect weather has on energy consumption. It's important to note that this information has been normalized based on conditions. We're essentially putting all of the hospitals in the same place, geographically. This eliminates the influence that a hospital in Sudbury will consume less electricity to cool than a hospital in Windsor. This graph is focused on how much energy is needed to maintain the temperature and humidity set points in the hospital. We have ranked the facilities from the worst performers on the left to the best performers on the right. And this range of consumption is approximately 8 kilowatt hours per square foot for the worst performers and just over 2 kilowatt hours per square foot for the best performers. This means again that the best performing hospital operates their facility using only 25% of the energy per square foot than the worst performing hospital. This is all normalized for temperature, meaning that regardless of the climate they're in, the hospitals are performing this at this level. So what happens if we put them all together? Bringing these two graphs together gives energy managers a new level of visibility into the effect of energy on hospitals. More importantly, it shows us how to positively influence change. Ultimately, we want to take this mountain of information that is contained in this one graph and turn it into strategic knowledge about the hospital that enables energy managers and facility operators to make great decisions about energy conservation. But how do we do that? Here are a few of the best ways to understand how to take benchmarking information and turn it into knowledge. We can compare how our building is operating in comparison to other buildings. By sharing this information with other facilities, we can enable change. This is the Greening Healthcare model. We can identify parts of our facility that are doing well or doing poorly. We can look at our heating and cooling information to identify equivalents that are working well. For example, if our weather-related benchmarking tool is in the 75th percentile during the winter, but only the 25th percentile during the summer, we know that our cooling system must be looked at, but our heating system seems to be working well. Without this granularity, a hospital may think that they are performing well in the 50th percentile without the different commodities being measured. Finally, hospitals will understand that if they operate at different levels of efficiency depending on the season. This is all available from the Energent benchmarking tool. So let's take a look at a specific case study which highlights the power of the program. This case study is based on a Canadian hospital. This hospital is the worst performer when it comes to weather data, consuming almost 8 kilowatt hours of electricity per square foot to manage cooling. This hospital was built recently, so there's some research that needs to be done to understand why a hospital, which has a newer HVAC system, a newer BAS, high-quality insulation and windows, etc., is performing so poorly for weather. Well, let's start to see how we can improve their performance. Let's put the information from the Energent benchmarking tool and see if we can improve the weather-related performance of the hospital. Pulling the specific data from this case study, we can accurately answer the following questions regarding the weather-related energy performance of the hospital. What aspects of the hospital's operations can we identify as reasons for this poor weather performance? If they do improve their weather performance, what does it mean for the bottom line? How does this benchmarking tool help the energy manager or facility operator improve the hospital performance? Let's start and see how we can improve their performance. In a newer hospital, there are limited opportunities to improve weather performance. The boilers are new and the HVAC systems are modern and efficient. Well, how can we affect change in this scenario? Well, here are 3 ideas. Number 1, look to maximize building automation system performance. In newer building automation systems, the opportunity to customize using temperature and humidity settings are enormous. With the opportunity to customize comes increased levels of complexity. We would suggest investing your BAS and understanding how the system is scheduled and if a dedicated BAS expert is required to manage this powerful and complex system. There are many opportunities to leverage the power of a BAS, but without the proper attention, it can actually become an energy waster instead of a saver. With the improvements in HVAC systems, there is an increase in the expectation of facilities teams to manage the set points of the hospital much more closely. Because the system can manage a hospital within 1 degree Celsius, 24 hours a day, does it really mean it has to? When there's a narrow band of managing set points, equipment tends to be cycled on and off frequently. This can cause an increase in energy expenditure as equipment ramps up to temperature, and often these large pieces of equipment are not built to cycle on and off all the time. It can reduce the life expectancy of large capital upgrades. Finally, many hospitals have increased the amount of windows that are installed in the building to encourage natural light within the hospital. But in warm summer months, this can cause a significant increase in cooling requirements because the natural light warms the area. But in shaded areas, the temperature sensor might read a significantly lower temperature. So the BAS becomes confused. If this is the case, shades are an inexpensive way of reducing the heat from south-facing windows, yet can still let some of the natural light in. There are ways to quantify the specific effects of each of these opportunities for improvement. So if you are interested in finding out more, please let us know. Now, we can talk more specifically about the impact of the hospital financially if we are able to improve the operations of the hospital with respect to weather. There are specifics to electricity. These are specifics to electricity in this case study, but the same information can be completed for natural gas as well during the heating season. If we were able to bring the client down to approximately 5 kilowatt hours per square foot, or at the 25th percentile of these Canadian hospitals, it would save the customer $21,000 annually. This means that 75% of the hospitals are still operating more efficiently with respect to weather than this hospital, but it still saves them a significant amount of money. If we were able to take them to the 50th percentile, or approximately 4 kilowatt hours per square foot, this would save them $28,000 annually. And finally, if we were to bring them up to the 75th percentile, or better than 75% of these Canadian hospitals, the client would save a whopping $43,000. These are not insignificant savings, considering there is little to no capital expenditure and do not affect the regular operations of the hospital. Hopefully this case study highlights the importance of benchmarking in general, and specifically the power of Energent's benchmarking tool. Harvard Business Review conducted a research paper on benchmarking best practices across all industries. Now, this was not specific to hospitals or the public sector, but benchmarking practices in general. They came up with 5 critical best practices that should be adhered to when any organization is looking to begin a benchmarking project. And they are: find the critical metrics in your organization. This is such an important step. Ensure you are measuring the important aspects of your hospital's day-to-day operations. Measure and compare based on aspects of your hospital that have significant impact on your energy use. This could be patient throughput, number of operations or MRIs per day, or other relevant energy-consuming activities. Those metrics fall into the operations side of the model and ultimately dictate your overall energy intensity, or kilowatt hour per square foot. Measure what's needed, not what's easy. This is important when ensuring the numbers you are looking at are relevant to the knowledge you want to get from the program. If you want to improve your weather-related building performance, ensure that you are measuring aspects that are related to weather. For example, number of patients in hospital is relevant, as an increase in people can increase the cooling load that is necessary. Number of procedures of MRIs does not have an impact on the cooling load of the hospital. Find the happy medium in frequency. Benchmarking on a daily or weekly basis may not provide the results that most facility operators want. Annually may be good for an annual review, but it may not provide enough information to act quickly on the changes. Monthly reviews may be the best options for many hospitals to balance the need of good information and the ability to act on that information. Involve people from all levels of departments. We have said this in many other webinars as well, to get people involved. This should be a project that involves many people from different parts of your hospital, as their actions have a direct impact on the energy consumption of the building. Get their input, and more importantly, get their buy-in. It will make benchmarking programs more accurate and more relevant to the building. Benchmarking can be done by comparing internal metrics as well as external groups. Each hospital is going to have their own key metrics, as discussed in the first point, but they may not be the industry standard that multiple facilities are compared to. Both are important and provide different information to energy managers. Look to be part of external groups, but don't abandon the important internal benchmarks in the process. So, to summarize today's webinar, we have explored the values of benchmarking and how they are very relevant to hospitals, particularly in light of the carbon and greenhouse gas reporting requirements that are coming to Ontario in July of 2013. We explored 3 tools that are currently available to hospitals and how to take advantage of the strength of each of these tools. We talked about how benchmarking is the most valuable when we can take mountains of data and turn this into knowledge to help facility managers make educated decisions. We walked through a Canadian case study that explores ways that a newer hospital is operating inefficiently, how to move them from a poor performer to the best performer, and what that would mean financially for the hospital. Finally, we went through 5 best practices for benchmarking to help facility managers understand how to maximize their involvement in a benchmarking program. Energent has been a trusted partner in the healthcare sector for many years, providing knowledgeable energy advice and analytics. We have customers across the country that use Energent to lower costs and improve efficiency. Energent is the first choice when it comes to healthcare and public sector energy management information systems. Here are 2 webinars that Energent is hosting in the near future. Please sign up by going to our website at the link which is provided at the bottom of the slide. On Thursday, September 20th at 2 p.m. Eastern, Energent will be hosting a webinar about how we can take all of this energy data and turn it into usable knowledge. We will address different charting options, how to identify savings opportunities, and how analytics can provide insights into these opportunities. On Thursday, October 11th, also at 2 p.m. Eastern Time, Energent will be hosting another webinar to discuss the basics of monitoring and targeting and how to use predictive analytics to improve building performance. A list of all of our upcoming webinars is on our website, as well as a link to previous webinars which have been completed. So we wanted to thank you for joining us on the webinar today. I hope you have a better understanding of how the benchmarking process and how to leverage that for your own hospital. For more information, please visit our website. We have a specific page dedicated to the hospital sector and your needs specifically. You can find out a lot of information on how Energent can help manage these increasing electricity costs and better manage and understand the overall cost of energy. So we'll take some time now to answer some of the questions that were received during the presentation. So the first question was, isn't the updated Energy Star program going to provide for weather normalized data? The answer is yes. So they absolutely do provide weather normalized data based on the weather zone that you are in or the zip code that you provide. So that is absolutely true that the Energy Star program does normalize for weather. So what that allows is to, as we talked about putting the building in the same geographic location, it really does provide to that. The Energy Star program is great, and we're certainly big fans of the Energy Star program. I think where we are looking at utilizing the Energent tool slightly differently is to be able to segment the information from weather and operations in separate graphs so that we understand what contribution of your energy bill, whether that's natural gas or electricity, that we understand what component goes directly to heating or cooling and what component goes to operations. So so the Energy Star program is great, and they're improving it all of the time. And certainly for a self-inputted type of program, it does provide much of the information that many people are looking for. One question here about hospitals outside of Canada. We do, at this point, we haven't been able to include any of the hospitals outside of Canada. We do have hospitals in our database from coast to coast here up in Canada, but we don't have any data that we use for hospitals in the United States. And certainly we've been getting some interest in sort of the real-time information of energy management systems from the U.S., but at this point we don't have any of the data that has been included in our database at this point. Are there any other questions while we're here? Okay, well, if there are other questions, please, you can see my contact information on the slide. Please feel free to send me an email or give me a call. Be certainly happy to answer any of your questions that you have, and hopefully we'll provide you with some information that helps you. So I hope everyone enjoyed today's webinar. Enjoy the rest of your summer, and we are having a whole new slate of webinars coming up starting in September. That hopefully will really pique your interest and help you improve sort of energy management in general and help you conserve energy in your building. So thank you very much for attending today, and we'll see you in September.